Welcome back. We are answering your questions about the coronavirus with Cone Health's Chief Medical Officer for Women's Health, Dr. Carolyn Haraway-Smith. Remember, you can text your questions. The number is at the bottom of the screen. All right, this person is asking, I'm getting the second vaccine Wednesday, and I'm also getting a COVID test the same day for a trip. Is this okay?
Sure, yes. So the COVID vaccine does not give you COVID. And so getting the vaccine won't make you test positive for COVID. So there's no correlation there.
All right, this person is saying, can COVID-19 cause high blood pressure and/or a high heart rate with low oxygen levels?
No, it should not. Again, COVID vaccine doesn't give you an infection. I will say that if you're having any symptoms, usually again after that second shot, you could have that ill feeling. It might make your pulse rise if you have a temperature, and it could potentially affect your blood pressure there, but that's not something that we're seeing a lot of, no.
Mm-hmm. This person is asking, how long do you have to wait after you've taken your last antibiotic to get a COVID vaccine? Is there any correlation with that?
Not that I'm aware of. And so that's so variable. It depends on the antibiotic, but I don't know of any relationship between a specific antibiotic and the COVID vaccine.
Mm-hmm. This person says, why should I feel comfortable taking the shot when the CDC and the FDA website states that the vaccine isn't 100% protecting me from the virus? Why should I feel comfortable?
So that's a good question. The vaccine is not 100%. For the Pfizer and the Moderna, they're in the 95% protection rate. And when we say protection, we're referring to protection from hospitalization, death, severe infection. So those are very important things because the ultimate goal of the vaccine is to really prevent these horrible outcomes that we've seen. When we have over 500,000 deaths solely related to the virus, then we want to prevent that. And if we can prevent one death from that, then yes, it is worth it. But no, it's not 100%. I don't think we have 100% prevention from anything. So I think that the 95% gives me a great deal of confidence.
Mm-hmm. This person is asking, will my 14-year-old be eligible for the vaccine?
Unfortunately, not at present. With the Moderna and the Pfizer vaccine, that's being offered to children who are 16 and over. And the Moderna and the Johnson & Johnson are offered to young people who are 18 and older. There's some trials going on in children, and those are looking promising. But at present, children under 16 are not approved for either of the vaccines.
Mm-hmm. This is a little complicated of a question. This person says, if someone in my house is tested positive for COVID, but I'm scheduled to get my second vaccine tomorrow, can I get my second vaccine if I have no symptoms, not even a temperature?
So the answer is really no, you should wait. And the reason is if you've had that close exposure, then you're really at risk. And when you go in for your vaccine, they're going to ask you if you've had any close exposure. So the recommendation is to get a COVID test. Wait a week, get another test, and if you're still testing negative, to go ahead and get the vaccine. And I've been in similar situations where we're watching, and on that second test, individuals had tested positive. So try to make sure that the person that you're exposed to is quarantined and stay away from them as much as possible. But remember, if you have that close exposure to someone in a household, you're supposed to be quarantined as well.
Even though you've had your first dose, because again, you're not totally immunized yet.
Correct.
Okay. All right. Thank you so much for your time. We so appreciate it. For those of you who may have just been joining us and you're wondering about women's health and fertility and mammograms when it comes to the COVID vaccine, we're going to be posting all of this on our website in the Who Wants to Know section. Thanks for joining us today, and we'll be back with WFMY News 2 at 6 coming up in just a few minutes.